Hello and welcome back to Carlos and Lisa. I'm Lisa Remillard.
And I'm Carlos Amesqua. At tonight's debate, most likely we'll hear a majority of the Democrats running for president talk about their plans to change our healthcare system.
One of those most popular plans is, of course, shifting our current healthcare system into what they call a Medicare for all model. Now, I'm sure you've heard that term a lot, but before you get excited about free healthcare, just pump the brakes.
I like that. You pump the brakes.
Just pump the brakes.
We want to break down what that means and give you some context. All right, first, understand Medicare for all means something different depending on which candidate is speaking. Some candidates want to eliminate private health insurance altogether. Others want to reform the private insurance system we currently have and supplement it with Medicare for all. So not all of these Democrat plans are the same.
Second, it sounds very obvious, but it's worth mentioning that taxes will probably increase to support such wide-reaching government health care system for 330 million Americans.
And third, the United States is behind other developed countries when it comes to some form of universal health care. Countries like Australia, France, Germany, Singapore, and Switzerland, the NHS in Britain, for example, has had it for years.
Yes, so there's lots of upsides and downsides. So let's talk about the upsides. One of those upsides, this type of universal health care overall costs less for an economy. Governments, on average, spend less on health care because people are able to take advantage of preventative medicine, and everyone is paying into the system.
It also, they say, lowers the cost for the individual citizen. A study of people who live in countries with some form of universal health care found they spend an average of $4,800 per person every year on health insurance, supplements, medications, or elective surgeries. Now, in the U.S., we're spending about $9,900 per person every single year.
Look at that difference.
Yeah.
That is a lot. So now the other downsides, on average, about 50% of the people in countries with a form of universal health care wait more than 4 weeks to see a specialist. Yeah. They talk about a lot of wait times just to see regular doctors,
yeah.
too. Most governments with single-payer health insurance also keep hospitals and doctors on fixed budgets to control costs and even limit services.
So here in the U.S., President Trump just publicly solidified his disapproval of any type of Medicare for all plan that would eliminate our current private insurance system. He signed an executive order that bolsters private Medicare Advantage plans for seniors, for example. It's a complicated issue, but some people think it'll be a deciding factor in the upcoming election.
So we invited a professor of economics of social issues, Dr. Jamshid Damooei, here from Cal Lutheran University to talk about Medicare for all and what it really is. Hi, Jamshid. Thank you for coming.
Thank you for the invitation.
Sure. Okay, so let's talk about, is Medicare for all good or bad?
Well, is it that simple?
Is it that simple?
It's not really that simple. If you want my opinion, without really going to justify, which I obviously get the chance to do it, I am really for Medicare for all. I am actually, more importantly, for what is called universal health care. And the issue of single payer or not has to be really examined in the light of what is really that implies, because if you think about health care, we're not producing anything new. Health care exists. What we're doing, we're really trying to change through Medicare for all, or call it universal health care, single payer. We're trying to change who is going to pay for it and how. Now, there has to be some issues which we can really compare. In your conversation, you brought up so many important and relevant and good points. For example, you mentioned that, well, we pay on average. By the way, the latest data I looked at, it was like per capita spending on healthcare in the United States exceeds $10,000.
So it's gone up.
Gone up. Compare it to United Kingdom, which is just over 4,000. So you kind of beg, to see, okay, what's the difference there? Okay, you mentioned that you have to wait longer in the UK than here. But here is another angle. About 28 million people in the United States currently, based on the latest information, do not have health insurance. So keep that in mind, and let's add some other numbers there. A large number of people who have health care insurance, either themselves or through their work, are underinsured. So if you really look at how long we have to wait, you have to bear, and look at these issues, bear this in mind, and look at these issues, how that would affect. What I think is important and can help people to make sense of these issues is that what this waiting cause in terms of the quality of the healthcare or the intervention in timely manner to prevent death or injury or other problems. We don't have credible studies to show that.
So what's interesting to me is that there is a desire on the Democratic side to make sure that everyone is covered, that everyone has accessible health care, no matter what your economic status is. On the Republican side, they want to make it more competitive so that prices will become more competitive and therefore lower so everyone can afford it. But there are still going to be people who can't afford anything.
Perfect point. But can we examine that? You
Okay.
see, for example, if you look at that, will the cost of care come down or not? 5 studies, people who really want to find about it can look at it. Credible studies being done with different degrees, But all of them agree on one thing, that the total cost of healthcare over time will decrease. But here's the different components of it. Again, these studies show that if you're thinking about, how much hospitals will receive, will that go up or down? Will go up. The reason is because these hospitals really right now do not receive, compensation for some of their work. They have differential payment, whether it is by Medicare versus insurance companies. So you have all of these issues. But if you look at, for example, drugs, all of these studies with different degrees predict that the cost of prescription drugs will fall. Now, the other thing is that, what you get for it, when we talk about underinsured, the Medicare for All or universal health care, single payer, wants to add vision or, dental or mental. So the quality or the extent of the package is an important issue to look at it. But if you really look at it, in total, the cost will fall. Now, the other thing is that, will that be any other savings? Yes. The saving is that if you have one system that works, let's say, over the entire country, then you have reduction in the administrative cost, other things.
So, Jamshid, I mean, when I was studying all of these other countries that have some sort of Medicare, some sort of universal medical health insurance or healthcare plan, they're talking about quality of care going down in some cases because the government runs it, or because the government subsidizes it, and the doctors don't have the incentive to spend more time with a patient or give them higher quality of care or utilize new technology because simply there is no money.
That's a good argument. But here is the other way to look at it, or at least consider that also. When we talk about the quality of healthcare, again, I'm an economist. I really look with numbers.
You look at numbers.
I look at to see how studies prove or disprove. Life expectancy. Ours is shorter. If you think about, the children, I think it's called the rate of death among the newborn. It's higher. Okay, so if you really see it again in terms of the aggregate data, the studies, there is no indication that those countries who have these type of arrangements, take for example Canada, England, anywhere, they really don't really show that. Their life expectancy is infant mortality, that's the term. Infant mortality is less than ours. Ours actually is the highest among them. So if you really look at these kind of studies, they don't indicate it. But I do accept that part of what we think about quality is perception. And the perception is something that we are used to, not this type of healthcare. So there would be some fear. Because right now, if you really look at it, what percentage of Americans actually support universal health care, Medicare for all, single payer? 60%.
So would it hurt us to continue on with the process that we have now with some private health insurance and public assistance as well? Is that a better balance than having Medicare or universal health care?
Well, if you have Medicare for all or universal health care, single payer, so everybody will have it. But how you will pay for it is this. You mentioned about the tax. That's a very important issue to really, again, bring up and talk about it. All people that will receive health care, literally, at least, with the bill that is right under discussion, in 2018 was submitted, Bernie Sanders, I think, has submitted that. If you look at that, to see that what people will pay out of pocket or what kind of care they get, well, they receive, vision, they receive, dental, mental. They don't really pay anything out of pocket. They'll all be eliminated. Right. But how would that be paid? Obviously, the money doesn't grow on trees. You have to tax people.
Right.
So how do we really tax them? Again, if you look at the tax, so the tax payment goes up. then our payment that we pay, you mentioned that actually in the beginning of the program, that will go down. What would be the net gain? For people round about, maybe about $200,000 income, the net return is positive. Then you go into higher income, no. The higher income people will pay more in terms of the taxes, and then they will pay now. And if you go very high income, they pay more. Right. So there is that difference. The difference is that some group of income will pay more, other groups of income will, at the end, they'll pay more taxes too, but their net impact would be positive on them. And this is really the issue that we have to really look at.
It is a complicated issue. It is a complicated, but we appreciate your economic expertise on this. Thank you so much for stopping by.
Appreciate you being with us.
Thank you for your invitation.
We'll be right back.